Hello everyone. In this video we're going to be looking at blood pressure. We'll talk about what it actually is, the factors that affect blood pressure, and also the causes and the consequences of a high and a low blood pressure. So what can happen in both of those circumstances. Now this is just kind of a starting point that I use with my students. I show them this picture and then I ask them, what is this piece of equipment? Now this is a blood pressure monitor. Its real name is actually a sphygmomanometer. Now you don't often see that word, but it's actually called a sphygmomanometer. So you put this blood pressure monitor onto somebody and it will just give you a random reading. And we're going to talk about what those numbers actually refer to. First of all, what blood pressure is. Blood pressure is the pressure of the circulating blood against the wall of the arteries. So let's just draw here on the bottom of this picture. Just imagine here's an artery here. We've got the red blood cells here traveling within the blood. The blood pressure is the pressure that this flowing blood exerts on these walls of those arteries. And it's measured, it's quite an unusual measurement, in millimeters of mercury. MM is millimeters, Hg is the chemical symbol for mercury. So the blood pressure reading will come out as a millimeters of mercury value. But I'll be explaining what the values actually mean in just a moment. So let's just think about blood pressure in terms of age and what the sort of numbers mean once you've got a reading. So here, where I've just drawn the arrow, is our normal blood pressure value. And you can see in this table we've got two terms, systolic and diastolic. Now, systolic is the blood pressure post-heart contraction. So it's the maximum pressure that the heart can achieve when pumping the blood. So our systolic is almost like a contracting pressure. When the heart contracts and it generates a pressure to push that blood out with, that's what the systolic is. The diastolic pressure is the pressure when the heart is relaxing. So when none of the chambers are contracting and pushing the blood out. It comes from the terms systole and diastole. Systole is heart contraction, diastole is a phase of relaxation. So if we look at the normal, we can see that between 90 and 119 is a typical systolic pressure. So 90 to 119 millimeters of mercury upon heart contraction. And at rest, we should get a value of between 60 and 79. Now, often when someone takes your blood pressure and they give you the value, they often give you the systolic over the diastolic. So they'll give you two numbers, the systolic over the diastolic. So often you see, like in textbooks, when they refer to blood pressure, they sometimes give a sort of average value of about 95 over 70 maybe. We're just picking two numbers within the normal range. So they give you the systolic number and the diastolic. So 95 over 70 means 95 for a systolic pressure, 70 for a diastolic. But we can see in a state of pre-hypertension. Now, pre means before, and hypertension is high blood pressure. Low, that's how to remember it. Hypotension is low blood pressure. So we can see in hypertension, we're going well above 119. We're looking at these numbers here. So a number over 119 for our top systolic pressure, you can see we've got a high blood pressure, which is a sort of dangerous setup to be in. It means that the heart is having to maybe work a little bit harder to pump that blood around the body, more than usual. Now, in terms of age, the older you are, the more likely you are to have an increased blood pressure, just because you've really exposed yourself to a greater number of risk factors that affect blood pressure. So let's just draw a very straightforward picture of the heart here. We've got the chambers in place. You can see this is a very, very quick sketch here. So we've just got a basic 2D picture of a heart in here. Now, the force created by the heart is one of the key factors in determining blood pressure. So there are actually three factors that affect blood pressure. So number one, the force created by the pumping heart. So when this pushes all the blood out, the force it generates can determine what the blood pressure is. The second important factor is the volume of circulating blood. So the volume of circulating blood. So how much we have in our big chambers to push out. Because clearly, the bigger the volume of the blood, the greater the pressure. We're having to push more fluid essentially around our body. So quite clearly, the third and final factor affecting blood pressure would be the diameter of the blood vessels. So the diameter of all of our blood vessels would be the third. Because quite clearly, if you think it through, if you have a massive force generated from the heart pushing lots of volume of blood through what could be a very narrow blood vessel, it's going to generate a significant amount of pressure. And in another video, I talked about the effect of atheroma in the blood vessels. So that they're one way in which the diameter is significantly reduced. So these are the three factors that ultimately affect blood pressure. Think causes of high blood pressure. So we've said blood pressure ultimately is just the pressure of the circulating blood against the wall of the arteries. But in certain cases when we have maybe sort of lifestyle factors coming into play, the blood pressure may raise to a level that's quite dangerous in a state we called before hypertension. So let's think about some of the factors that could contribute to high blood pressure. So we've got an increased amount of salt intake. So we're just going to fill this up a bit like a brainstorm of all the different things that can cause high blood pressure. The body actually retains more water and the blood volume is increased when our salt intake is increased. So an increased level of salt can contribute to high blood pressure. One of the causes actually mentioned before is atheroma, which is a buildup of a fatty plaque in the wall of the arteries. Not only does this narrow the lumen, which is essentially the space there where blood flows, like the hollow inside, but it can also massively reduce the elasticity of the artery wall, making it harder for that volume of blood to get through. So we have an increased salt intake. Now, just going back to the salt, it is largely to do with osmotic pressure and the fact that high levels of salt in the blood draw water into it. But we're not going to go into that much detail in this video. So we've got an increase in salt and atheroma. One of the causes is kidney disease. Now, again, we're not going to go into massive detail about the ins and outs of kidney disease, but as an end result of kidney disease, you actually could retain high levels of salt and water in the body. And by doing so, you would increase the volume, one of the key 3 factors that can contribute to or that affect blood pressure. So kidney disease is a cause of high blood pressure. Then we come to real things like lifestyle choices. Smoking. Smoking is a major one. Nicotine is a vasoconstricting drug. What that means is, so vasoconstricting, vaso, vessel, constricting, narrowing. So it's a vessel narrowing drug. So you're going to massively reduce the diameter of the blood vessels. So clearly, if you have a certain amount of fluid going through a narrow blood vessel, you're going to increase that blood pressure. And smoking can actually damage the wall of the arteries, especially the coronary arteries. And anything that damages those walls, the body sort of responds by thinking it's under attack. And in the atheroma video, you can see that as an end result, you can start to build up actually a bit more fat on the wall of the artery as a result of that. So smoking has multiple kind of effects. Being overweight. So being overweight is a significant contributing factor to high blood pressure. If you are overweight, then you're putting the body under more strain. You're having to force the blood that little bit harder, essentially, to push it all around what is a larger person. And one other cause of high blood pressure we can note here is age. The arteries tend to lose elasticity the older you get. So we can take age as our final sort of cause of high blood pressure. Now, there are a handful of more, but these are the key ones. An increase of salt intake, atheroma and buildup of fatty plaque, kidney disease, things like smoking, age, and generally just being in overweight, in a kind of state of unhealthiness, you perhaps could say. Okay, so let's think some of the consequences of high blood pressure. I mean, quite clearly, there would be a greater risk of heart attack or myocardial infarction. So a greater risk of heart attack, which is a myocardial infarction. Now, it could be that essentially, over time, if an atheroma has been narrowing a blood vessel, the body just finds it too hard to push that fluid through past essentially a fatty buildup. And if that fatty buildup occludes or blocks the whole vessel, then clearly a heart attack could be the end result. And equally, there is a greater risk of suffering a stroke as a result of high blood pressure. In the kidneys, which act like filtering units, there is a section at the top called the glomerulus that filters the blood. So clearly over time, if you have a high blood pressure, if you're exposing the kidneys to that, then kidney damage could be one key result. So more than just kidney disease, but complete damage to that kind of filtration unit that you have. And you can damage the capillaries in the retina of the eye. So blurred vision, or even potentially blindness, depending on the level of severity, could be a significant consequence. I think it's only right that we finish this video by talking about the causes and consequences of a low blood pressure. You don't often think about low blood pressure in school. We tend to deal with high blood pressure because it ties very much to the topic of sort of heart attacks and risk factors. But it's really just for completeness sake. You can get something called surgical shock. Now that's when you get a sudden acute, so a very quick drop in blood pressure, and that can actually come from a variety of things. A hemorrhage or a loss of blood could cause that. A head injury, a loss of consciousness, a heart attack, so myocardial infarction, or even hypothermia. Hypo means low, thermia referring to a temperature, so a state of sort of extreme cold. So you can get a drop in the blood pressure through hemorrhage, heart attack, hypothermia, a loss of consciousness, and typically head injury. And you can really detect and pick that up from a variety of symptoms. The person may faint and appear severely lightheaded and dizzy. And actually, in severe cases, if you were to feel their pulse, you'd notice it's very weak. A low blood pressure can be as devastating as a high blood pressure, and perhaps in the immediate, perhaps more noticeable, especially if somebody's fainting or appears very, very lightheaded. That's just a few causes and consequences of a low blood pressure, because it's important to consider that. But often in exam questions, you'd get asked about, I think, a high blood pressure, and certainly the factors that affect it. The key thing from this video is to remember that the force created by the heart, the volume of the circulating blood, and the diameter of the blood vessels all contribute to the blood pressure. And making sure that all of those are in check is essential to retain a blood pressure within the sort of normal systolic and diastolic range. Okay, hope that helps.